my name is Rolando Arellano with your Medicare by AYA and Associates, where we clearly understand that choosing a Medicare plan can be complex, convoluted, and outright confusing. With over 25 years of experience, we pride ourselves in making this process clear, simple, and understandable. And in today's lesson, we're going to speak about Medicare terminology. Most people that come in and choose a Medicare plan really don't understand a lot of the verbiage and the information that's being provided to them by the agent, by the commercials, or by the documentation that you receive in the mail. So my job here today is kind of help you guide or demystify what all these fancy words mean. Okay, so let's get going. Today's lesson is Medicare terminology to be familiar with. Rolando Arellano, that's myself. I'm your Medicare specialist or expert here. It is important to disclose that this presentation is just a brief preview of the main topics associated with original Medicare. Original Medicare is more complicated and applies to people differently. It is important that you get the advice from a licensed and experienced professional to ensure that you get all of your questions specifically answered. Here is your outline, right? And in your outline, you have about 15, and I think 2 more on the next file of different topics that we're going to cover, like what is Medicare, what is Medicare Part C, and not to get caught up, what is PPO, what's a copayment, what's coinsurance. As you can see, there's a lot of fancy words here. Most people don't understand it, and my job is to, by the time we're done with this lesson, hopefully you'll have a reference guide to make sure that you understand the terminology and that you yourself will have a better understanding of this terminology. Here's some more terminology like your primary care. What is a skilled nursing facility? Let's see. Original Medicare is federal health insurance provided by the Centers of Medicare and Medicare to help seniors with the cost of their health care. The program is funded by Social Security and the taxes people pay into the Social. Okay, you probably heard the word Medicare Part C. And most people don't understand what Medicare Part C. They didn't even know there was a Medicare Part C because you hear Part A, B, and D, but Part C is known as a Medicare Advantage plan and the type of Medicare health plan offered by private companies that contract with Medicare. Medicare plans provide all of your A and B benefits with some exclusions, right? For example, there's certain clinic trials which are not covered by Medicare. And even though you're still in the plan, Medicare Advantage includes different types of programs, we'll call them. One of them is health maintenance organization. The other one is a preferred provider organization. If you're enrolled in Medicare Advantage plan, most Medicare services are covered through a plan and a network of doctors. Most Medicare plans aren't paid by Original Medicare. They're paid by the company that the contract has been given to, right? And most Medicare Advantage plans offer prescription drugs, right? So here's where the alphabet soup comes in. Part A is your hospitals. Part B is doctors. Part C is basically a contract with private companies to manage your health care. That way Medicare is no longer involved, but you still get the benefits that Medicare offers. And then there's Part D, which they include in Part C, which is your prescription drug plan. We have a lot. This is what your card looks like. I'm sure you're familiar with that. And then Medicare Part D is also known as prescription drug coverage. Okay, what is an HMO? It's a Medicare Health Maintenance Organization. Okay, so what is the PPO? All right, a preferred provider organization. Typically, PPOs work with Medicare and a Medicare supplement, and they allow you to choose the doctor that you want to go without a referral. So that means that you can actually go to your primary care doctor, and then you can choose the specialist without having to get a referral from your primary care doctors. A lot of people like this. It offers a lot of flexibility, but it's a Medicare supplement plan, and of course there's there's premiums attached to that also. And some Medicare Advantage plans are offering PPOs now, which is pretty good because you kind of can choose the doctor that you want within their network and not worry about your premiums. Okay, here we got what is a Medigap Plan. A Medigap Plan is another word known as a Medicare supplement plan, and it's sold by private insurance companies to fill the gaps in original Medicare. What is a premium? A premium is your monthly payment. So every month you have to pay to keep your insurance. Some Medicare Advantage plans do not have any premiums. Medicare supplement plans definitely have premiums. A premium is your monthly payment. Every month, what you pay for your health insurance. Okay, so what is a deductible? So let's keep it simple, right? A deductible is the amount of money that you have to pay before the insurance company actually starts paying them. The money that you take out of your pocket. There's different amounts depending on your situation. A deductible, money that comes out of your pocket that you have to pay before the insurance company actually puts its portion in. Okay? What is a copayment? A copayment is the amount you may be required to pay as you share the cost for medical services, like your doctor visit. So now you see how this starts piling up. So you have your premium, you have your deductible, and now you have to go to the doctor, and the doctor wants his $20 or $10. That is what is a copayment. Or if you get prescriptions, right, you'll have to pay a copayment of could vary anywhere from $1 to, I don't know, $50, depending on the situation. Co-insurance is the amount you may be required to pay as your share of costs of services. Like, for example, original Medicare, your co-insurance is 20%. You pay premium, you pay deductible, plus 20% of Medicare approved costs. Okay, so you'll hear a word thrown around quite often, not only in Medicare, not only in Medicare Advantage, Medicare supplement plans, but just in general. You're probably familiar with it because you had insurance in the past. It's known as the maximum out of pocket. What is the maximum out of pocket? It is the out of pocket, the money that you have to pay, the most amount of money that you have to pay per year for covered health services. When you're determining the amount that you have to pay, you have to take into consideration how much did you pay for deductibles that year. Number two, how much did you pay for co-payments? And number three, how much did you pay for co-insurance? It's very important to understand that maximum out of pocket does not include your premium. Your premium is totally separate and will not be taken into consideration to determine whether or not you maxed out for the year. Okay? Another word that you'll hear is called credible coverage. Did you have credible coverage? And basically what that means is that did you have coverage at least as good as Medicare provides? Example of that coverage is union insurance, employer insurance. But remember, the key here, in order for it to be classified credible coverage, it has to be just as good as Medicare, if not better. End-stage renal disease is basically injury, or no, it's not an injury, it's a permanent kidney failure that requires regular course of dialysis, okay? What is lifetime reserve? Okay, a lifetime reserve in original Medicare, these are additional days that Medicare will pay when you're in the hospital for over 90 days. So every year you have 90 days that you can spend in the hospital that Medicare will actually cover. However, if you stay over 90 days, there is a reserve that Medicare provides for you for your entire life as a beneficiary, and you can take from that reserve and add it to those 90 days so that you can complete your 100-day stay there, and Medicare will pay all the covered costs except for daily co-insurances. Okay, so that is your lifetime reserve. Every year you have 90 days. If you go over 90 days, you got a special little bucket over here that you can take from and add to your 90 days. Okay? Durable medical equipment is exactly what it says. It's durable medical equipment. It's walkers, wheelchair, hospital beds, shower chairs. Okay, what is a primary doctor? It is the doctor that you see first for most health problems. You're probably familiar with the primary doctor verbiage, word, definition, especially if you're accustomed to your HMO, because you got to go see him first. And then if you need a specialist, he's the one who basically refers you to your specialist, right? So it's kind of managed healthcare. Skilled nursing facility. It's a nursing facility with staff and equipment to give skilled nursing care, and in most cases, skilled rehabilitative service and other related health services. This is different than assisted living facility, where seniors are assisted doing their daily normal functions, bathing, housing, cleaning. The other one is medication, therapy, skilled nursing stuff. Okay, this basically I'm giving credit to Medicare.gov. This glossary explains terms in Medicare program, but it isn't a legal document. The official Medicare program provisions are found in the relevant laws, regulations, and rulings. I don't know whether that matters or not. Well, as you can see, this stuff can get complex, convoluted, and outright confusing. Our attempt here is to make it clear, simple, and understandable. And if for some reason we were not able to accomplish those goals, please do not hesitate to give us a call at 1-800-381-3623, 1-800-381-3623. You see my email right there, Rolando at yourmedicarecoverage.net. And please don't hesitate to visit my website, www.yourmedicarecoverage.net. Thank you very much, and have